One of the biggest controversies in medicine is prostate cancer, and will testosterone cause prostate cancer? There's been a long history of this hot debate in medicine, and it's really only in the last 10 years or so that some proper scientific studies have actually been done to look at this. And what was believed back in 1947, when this first medical paper was written about linking testosterone to prostate cancer, was in fact a very small study based on one individual who actually this conclusion was drawn from out of a total of 4 patients. It's a myth that's been perpetuated for time over the ensuing decades that testosterone causes prostate cancer, which is not the case. It hasn't been helped by the fact that the association of estrogen with breast cancer has also said, well, if that happens in girls, well, then the equivalent is happening with testosterone and the prostate in men. And there's been some very, very good scientific work come out over the past, as I said, over the past 5 or 7 years, that is showing that men with low testosterone are in fact more prone to prostate cancer, and not only more prone to prevalence, but also the more severe forms of prostate cancer. And so this is virtually turning on the historical treatment or historical fear that testosterone may in fact cause prostate cancer, which is not the case. Now, it is still a hotly debated issue because you can get a room full of experts who will always argue, one will argue black and one will argue white, but the evidence is emerging, and it's good, strong evidence. And there's Dr. Abraham Morgentaler in the United States bangs the drum very loudly with some very solid scientific evidence that testosterone is in fact protective of the prostate. That's not to say that you don't respect the prostate. You actually, before actually initiating testosterone, it needs to be clarified that there is no underlying prostate disease. If there is, that obviously needs to be treated. Testosterone is not a treatment for prostate cancer, but if the prostate is clear, that there is no reason not to use testosterone in that particular individual.